everyone. This is Jill Caseworm. I'm an audiologist in private practice in St. Joseph, Michigan. I have been an audiologist in private practice for many years. We won't tell you how many, though. I'm coming to you today to talk to you about a topic that's really near and dear to my heart. It's the use of assistants in all various aspects of audiology practices. Just imagine, if you will, a day when you don't have to order supplies, you don't have to stock your rooms, you don't have to get interrupted in the middle of a scheduled test to go clean someone's hearing aid. Just imagine making your life a little easier. And I think that everyone would want to do that. I've done it for over 30 years. I wouldn't know how to practice any other way, so I'm hoping I can inspire some of you to use audiology assistants in your practice. I want you to know that I'm a doctor of audiology, and I own professional hearing services, and I am being financially compensated from ASHA to present this conference. So now let's really start talking about assistants. Assistants are just that. They're there to help an audiologist, to aid us in all of our tasks, and to make our lives a little easier. Believe it or not, audiology assistants have been endorsed by every professional organization for the last 40 years, and yet they're not being embraced to this day. In fact, only about 25 to 35% of audiologists have access and use an assistant in their practices. And I know everybody's wondering, and they've probably heard maybe from someone, well, I don't think that's legal in my state. I'm going to talk about that specifically, about when you can use an assistant in which states, and give you resources so you can find that information. But they really are a great asset to us. It's something that should be embraced and not feared. I hear many colleagues say, well, I'm afraid they'll take my job. If we're providing the supervision for the assistant, they'll never take our job because we're the one directing them and guiding them and determining their scope of practice, and it will never overtake us because they're there to assist us. So I hope this is a topic that some of you that have maybe never really thought about it will embrace. And it's a person who, after appropriate training and competency test, perform tasks that don't require our education and expertise. I mean, I myself in my practice, I'm pretty expensive to my practice. If you don't know how much every hour of your time is worth to a business, you really should. And you have to generate that much money back and actually twice that much at least to pay your salary. So it's all about making things more practical, actually. And I'll tell you about some of the ways you can do that. You know, it's a way to free the audiologist so we can concentrate on the things that our doctoral degrees qualify us for. So things that don't require education and expertise so that we have time to do the more complex task of evaluating and diagnosing the problems, giving the support to the family, and making the appropriate recommendations. Those are things an assistant can't do. And I'm actually going to talk about things that can and can't and shouldn't be in an audiology assistant scope of practice. So why would you want to use an assistant? Well, there's a lot of reasons. First of all, someone recently presented to me a list of tasks that audiologists perform in the 70s and a list of things that we are qualified and competent to perform today, and they're vastly different. Think about just the resources that we have available to us, the technologies that we have available to us. I remember when I first started in practice, the only type of hearing aids we had were big ITEs or bulky BTEs, and the only way we could adjust them was with a screwdriver and a little trim pot. You turned it right to reduce highs, you turned it left to reduce lows. That was the extent of what we could do with hearing aids. And now think about what we can do with hearing aids. It's amazing, but sometimes that takes a lot of time that takes us away from other things. So we really need to spend our time diagnosing, counseling, recommending, and best practices. That's the key to really success as an audiologist. So we have a very expanded scope of practice. Declining reimbursement. If you're working in a role and you're doing mostly diagnostics, you have to know that in the last few years, reimbursement has declined amazingly. I mean, to do a complete diagnostic test for Medicare, including air, bone, speech, reflexes, and tympanometry, the reimbursement is less than $60. Well, If that takes you half an hour, I can guarantee that 2 of those in 1 hour are not paying your salary. So really, we have to think about ways to expand what we can do and still have access to patients and access to help. Flexibility. As I mentioned, most patients wait 3, 6 years, even 8 years before they finally make that appointment to come in for a diagnostic hearing assessment. So let's say, and this happens often, I know, people that are in private practice, it's usually one audiologist and one support person. So here you are now, you're greeting this new patient, you're doing their test, you're asking them questions, you're trying to counsel them and maybe convince them to get help for their problem that's been there for many years, and someone walks in with a hearing aid that's broken. And you know that you just started your test, it's going to take an hour, so do you make that patient that walks in wait an hour, or do you make the new patient wait an hour? Well, obviously, you don't want that new patient to wait. So it gives you flexibility to kind of change your hours. I hear audiologists that work in ENT practices that their days are overwhelmingly busy, and there's so many things that we don't have time to do. Like, let's say you need to call a manufacturer. Let's say you need to look up some research for someone. It's just amazing the things that we accomplish in one day. And sometimes you just need a little more flexibility. And as I was mentioning about reimbursements declining, we have to be increasing our productivity. We know what's happening in this industry, and people now are wanting options when it comes to hearing care, and there's so many less expensive options, and we have to embrace those and include really everything in what we offer to patients. Well, the fact is we still have to pay our salaries, we still have to pay overhead, so the use of an assistant can really double the productivity of an audiologist and not double what you're spending in salaries. And the best part it is, you are the supervisor. I am the supervisor, and I determine what they're qualified and what we really want them to do, which obviously changes based upon the practice. Well, as everybody's told us forever, the population with hearing loss is increasing exponentially. I think I read recently that there's 10,000 baby boomers entering and turning 65 every single day. Well, just imagine we know most of those people have hearing loss. How are we going to help them all? Now, I'd like to say that my doors are just breaking down with all the people trying to get into my office. That's not quite true, but we are seeing an increase in the population of people with hearing loss and in the amount of baby boomers. Plus, we know people are living longer. So just practically speaking, how are we going to take care of all those people? There's only over 400 and some AUDs graduating every year, and yet 1/3 of practicing audiologists are over the age of 60 and going to be retiring. How are we going to replace people like me? No, I'm not over the age of 60, but I'm pretty close. How are we going to replace all those people that want to retire and still help the burgeoning population of people with hearing loss? One of the answers is using assistants. And as I mentioned, when it comes to an assistant and what they're able and capable of doing, it's really up to the supervising audiologies. Some licensure laws actually dictate what an audiology assistant does and is capable of doing in a practice, but in most cases, it's the supervising audiologist that determines what the assistant can do. So isn't that great? Not only do you have somebody to assist you, but you can determine what you want these people to do. As I mentioned, I'm going to tell you in a minute a great resource of going to the states and to this website at ASHA and really looking state by state at what the criteria is for becoming an assistant and the scope of practice. But I can tell you in most states, it's not the state licensure law that determines it, it's the supervising audiologist. But then you're also legally, ethically, the one that is responsible for what an assistant can do. And it only makes sense. If you look at other professions similar to ours, chiropractic, optometry, nursing professions certainly, and dentistry, they all use assistants because they have to really to be productive and to pay the cost associated with our practices. You think about a dentist office. My dentist would never clean my teeth. That's why he has an assistant, and that's why he has someone to do that, so he can concentrate, or she can concentrate, on the skills that they were trained to do, like problems, Optometry. My optometrist not only has an assistant, he has a scribe that puts all the notes in the computer, and he's told me that he can see 30% more patients because he has someone that's doing all the note-taking and following up on the notes. And now most of us can't afford that, but we certainly can afford an assistant. They're being used successfully and have been used successfully in many different types of practices. I've read that the use of the assistants in the VA has increased over 500% in the last 5 years. They have more and more vets coming in that need help. They have people living longer, and it's simply impractical to have an audiologist perform all of the tasks that they need. Schools, ENT offices, private practices, industries, hospitals. When you think about hospitals, it's not an audiologist that does the actual testing on newborns. It's usually a volunteer or perhaps an assistant, but they're being used very successfully and have been used very successfully for many years. Now this I just realized when I looked at this picture is rather old. This is one of my assistants who's worked for me for many years, and it's a little old because we don't use paper charts any longer. It's all electronic. But just look at that desk. If I didn't have assistants, if audiologists didn't have assistants, look at all the things that we would be doing that would require our time that maybe didn't require our education or expertise. Ordering hearing aids, following up on hearing aids that were sent for repairs, calling back manufacturers if there's a problem, updating softwares. Just think of the things that take your time that maybe don't require your expertise. Just the other day, we had someone come in and calibrate our booths. And before I went to test someone, because it had just been calibrated, I went to test all the equipment, and speech wasn't coming through the speakers. And you know how much time that takes. They had not done the calibration properly, actually, and our recorded speech coming out was very, very low compared to what it should have been. So just the time it took to follow up on that. Now, I have the luxury of having more than one booth. I could go and do the test somewhere else while someone else troubleshot that problem. And it's really important because it takes a lot of time to do some of those tasks. What we're talking about here is balancing revenue generation and non-revenue generation. I mean, if we're spending 50% of our time or more, which is very typical in most audiology practices and in any kind of work setting, we're not generating revenue for half that time. So that means we have to generate more in the hours that we are seeing patients. And so it really comes down to balancing revenue generating with non-revenue generating. If you don't know what your time is worth in any practice setting, you should, because you have to generate that, as I mentioned, or twice that amount. So you need to start calculating, or every person needs to start calculating what they're generating to know that they're paying for themselves, because that's what it's all about. You really want to track your activities and which ones are revenue generating, and you want to figure that out of what your time is costing a business. When you're generating twice that much, maybe it's time for a raise. These are just some of the ways you can use an assistant and use them successfully, as I have. Do you know that in most practice settings, audiologists spend their time when a patient's getting amplification? They spend their time telling them how to put in a battery, how to clean a hearing aid, what their warranty is, how to insert the hearing aid, how to insert the battery. They spend all their time doing that, and then they press best fit. Well, I'll tell you, that is not best practices, because it's been shown with research that when you do that, 35% of fittings are dramatically underfit or overfit, but not the most appropriate thing for the patient. In today's world, when you have everyone and their brother dispensing hearing aids, selling hearing aids, recommending the hearing aids, and possible the OTC legislation that we're facing, we have to know when a patient leaves our office with new amplification or adjusted amplification that it's as good as it gets. We need to be doing those outcome measures. And if we're spending all our time teaching people how to insert a hearing aid or how to clean it, we can't spend our time doing what we're really qualified to do. So in my practice, we schedule our fittings 30 minutes with an assistant, 30 minutes with the audiologist, and the audiologist spends all of our time then counseling the patient, doing the outcome measures, and making certain that the patient is really understanding how to handle the amplification and giving them realistic expectations. You know, you think about, I had someone come in yesterday with a new wireless accessory, and we were trying to pair it to their phone and teaching them how to disconnect it for their phone. That takes a lot of time. And as you know, time is money in many cases. And sometimes it just takes more hand-holding with the patient. This happened to be the third time that patient had come back to adjust to this wireless accessory. Now, people that don't have the time spent with them, what are they going to do? They're going to take the accessory and sometimes the hearing aids, and they're going to stick them in a drawer, and they're going to tell everybody they know, guess what? These things don't work. So it requires a lot of hand-holding. I think about the paperwork involved today. I mean, if any of you are doing VA testing, keep track of how much time that's taking you to do the paperwork required for that. Billing, if you happen to be doing your own billing, it takes a tremendous amount of time. These are all things assistants can handle. Now, some of you may not believe that hearing screenings should be in an assistant's scope of practice, but in many cases they are. And I'm going to talk about places that you can have an assistant trained so that they're very well qualified to do hearing screenings. Certainly hearing aid cleanings, assisting with pediatric patients, which sometimes take a lot of time. It really can make a big difference when you use an assistant. Think about the time that you spend stocking supplies. Nothing makes me crazier when I go into a room and I don't have the supplies. So now we have every one of our fitting rooms set up so that they're identical, which means the pricing sheets are here, the word list for a third party to possibly read or things for a third party to read are all here. And it's not my job to stock all those things. Loaner hearing aids and the supplies needed to change a receiver length or to fit a dome. They're all in the rooms. They're all stocked by assistants, and it's really a great asset to practice. So what are some of the things that we don't want assistants to do? Well, we don't want assistants telling patients what their next step should be, making recommendations to other professionals. That's things that assistants should not be doing. We don't want them counseling patients on how to handle things. We don't want them making or talking with families about pediatric patients and what they can expect in school systems. We don't want them saying, you don't need to come back anymore. But the fact is, assistants can be used very successfully if you have an established protocol, well-written job descriptions. We don't want them recommending hearing aids or saying, you know what, this hearing aid doesn't work. That's our job as professionals. But they certainly can do other things and assist us. Have you been to a Walmart lately? You're greeted by someone. And I think that's so great. You know, when I have a new practice, a new person coming into the practice, I want to make sure that that first experience is a good one. First experiences are memorable experiences, or at least should be. So when we have a new patient coming in, we make sure the assistant is ready, willing, and waiting when the patient comes in, greets them at the door and says, hello, Mrs. Jones. It's so nice to see you. We were looking forward to you. Why don't you get a cup of coffee, and we'll give you a tour of our facility. My practice is quite unique in its patient experience, and you can check that out at www.prohere.net and check out how unique our experience is, because we know that the patient experience is the new competitive battleground in healthcare, and you want to ensure that that first experience for your patient is a good one. And you can do that by having an assistant ready and willing to greet the patient. Don't just hand them a bunch of meaningless paperwork to fill out. Either they can do it ahead of time, perhaps from your website, but an assistant can provide a great experience. Let's say you're running a little late. The assistant can come out and say, you know, how about if I look in your ear, which in some cases many audiologists do allow their assistants to do that. How about if I take your hearing aid and clean it for you? How about if I play with your grandchildren that are here? Because sometimes people bring their entire family with them to their hearing evaluation. So assistants can be used to make patients happy and to make sure that that first impression is a good one. Now, Medicare, people always ask, can I bill Medicare for what an assistant does? The answer to that is no. Medicare is not reimbursing for diagnostic services that an assistant does. So you have to use assistants to perhaps set up the testing rooms or whatever, but if you're going to bill Medicare, it's really the audiologist that needs to be doing that testing. I can tell you that after using assistants in our practice, and we have one assistant for every professional, After using assistants for over 30 years, patients are very satisfied. I was giving a talk the other day, and an audiologist said, my patients only want to see me. Well, you need to set that up right so that's not true. You need to tell your patients, I'm here to help you in whatever way that you need. If you're having trouble understanding, if you're having trouble adjusting to amplification, if you have questions about the educational things happening in an educational experience with your children, that's what my job is. If you're having trouble, and you need to go to a physician, I'm the one that will make that referral. But if you need your hearing aid cleaned, you don't want me to do that. If you need your hearing aid repaired, trust me when I say I'm not the best patient to do that. I'm not the best person, But in most cases, if you give your patients a realistic expectation of what will happen in your practice, that you'll see me for these things and you'll see my assistants for other, patients won't be unhappy. In fact, we've found that our patients are delighted with our assistants. Most patients want things, if they have a problem, they want it settled completely and effectively in a short amount of time. And if you do that, they will be happy with seeing your assistants. You just need to tell them what to expect. Let's talk about the financial aspects of using an assistant, because certainly that does come into play. Now with AUDs, their salaries have increased, and that's fine. But you can't really afford to pay someone, and the average salary for an assistant is about $67,000 a year. You can't really afford to pay them if they're not generating, as I said, twice as much or more. So you can have one audiologist that's concentrating on the tasks that require their education and expertise and pay $70, or you could have two audiologists and pay $140, or you could have one audiologist at $70 and another assistant at $35, which is pretty common. Now you just saved yourself $35,000, and perhaps you as the professional can give yourself a $35,000 raise. Now who wouldn't want to do that, right? Assistants are not only practical, efficient, but they're also realistic when it comes to salaries and expenses. You can find what you should pay an assistant in an occupational outlook handbook, and you can do that by state, geographical area. You're not going to find audiology assistant, but being on several task force over the years, we know that other professions like optometry, chiropractic, podiatry assistants, if you look up their salaries, that's very, very similar to what an audiology assistant should be getting paid. And it's right around $30,000 to $35,000 a year. But then you have to add benefits to that if they're full-time, and that will increase this by another 30%. But you're looking at half of what an audiologist makes, so it only makes good sense. So I've studied a little bit, what kind of traits do you look for in an assistant? First of all, they have to be caring. They have to be a good listener. I have found on the DISC profile that an S, which is a steady person, they are going to be the best. They don't want to be the business owner. You don't want somebody who's in there fighting you all the time, like, well, why can't I do this? You don't want a real forceful personality. You want somebody who will follow direction. You want somebody who can multitask, which is really what we all need to be. Obviously, they have to have a good work ethic and show up on time, and, they have to understand the professional ethics of what they're doing and not to disclose information. But all those things are great things that can be trained. But if you're going to do I do recommend doing profiles on people before you hire them. Look for somebody on the DISC profile who's an S. There are several training modules. NOVA is great. It's online. There's two different programs, $500 each. One is amplification and one is hearing loss. The Ototech program, as audiologists, we may not want to use that, but certainly it does train people. KAOC is great. It teaches people how to do a hearing test and things like that. If you deal with hearing aids, you can always send them to a manufacturer to learn how to do repairs. And Dr. Nicole Kingham now has an online training program that's very good and excellent. It's something I just learned about, so you may want to look up her website. But most of the time, an assistant is trained on the job. They have to learn. It takes some time. They work side by side. I would recommend a very, detailed regimen to accomplish this. You don't want to put somebody with your patients unless you know they're qualified. That's very important. This is a great skill-building resource for assistants that ASHA has. Great place to go and for training materials and how to build skills. Certainly, With assistants, you want a built-in protocol for updating them on their skills. We actually have weekly meetings with our assistants. Twice weekly we get together. We have them bring to us patients they've seen in the last month or week and some of the problems they've encountered and teach them how to handle those things. We do chart reviews periodically to make sure that they are performing skills and that they're doing the things that we want them to do. So there is follow-up, and, of course, we ask our patients. So now let's just talk for a couple minutes about what assistants could do for us in case you don't have a vision for this. Number one, take this scenario, and new patient visits office for scheduled evaluation. Patient is wearing hearing aids from a competitor. Well, one thing, have the assistant take the hearing aids, check them while you're testing the patient. Sometimes in some practices they actually have the assistant go over some of the forms to fill out with the patient. Like I said, we have our assistants give the patient a tour and kind of let them know how things work in our practice, get them a cup of coffee. They can bring them back into the room and just kind of make them feel comfortable. So there are various ways, of course, in the test rooms. As I mentioned, the assistants can stock the rooms, making sure they're equipped and ready for testing. As I mentioned, in all of our fitting rooms, the assistants stock them, referral cards, appointment cards, all of the materials we need, satisfaction surveys. They can certainly send them out or go over them. If a patient sends their survey back and they have any areas that they're dissatisfied, certainly the assistants can follow up on that and schedule another visit if necessary. Big thing with walk-ins. That's always been a crazy point of mine. You know, I can't stand the thought of, I don't like making patients wait. Just the connotations of the word. You know, it's not a waiting room at my office. It's a greeting area. It's a reception area. But if you think about a patient walking into your office and they say their 6-month hearing aids don't work. These don't work. Well, my word, that could take you hours, right? And you're testing a new patient. Well, the first thing the assistant can do is ask the patient questions. Do you mean you're not understanding? And try to clarify what they mean by don't work. We all have people that come in and say, these don't work. These things don't work. Well, maybe they mean they're not understanding and maybe another appointment is necessary. We have our assistants do our warranty checks. They screen the hearing. They do aided discrimination testing it just by our protocol, which is well outlined. And if a patient is having problems, they'll go ahead and hook up a patient, and if they know the audiologist is going to have time in 15 minutes or so, and they'll say to the patient, you know what, we're going to hook you up, and Dr. Jill's going to be able to come in 15 minutes. Let me get you a cup of coffee or a cookie, and that way you won't have to come back for another visit. You want to make sure that things are as expedient for patients as possible because people are busier than ever, right? You have a busy day at an ENT clinic with 3 ENTs. Oh, my word. I can't even imagine how assistants could be helpful in this area because, you know, you're trying to make sure hearing aids are here for someone who's coming the next day. You have a call to come to return to a school system. You have a call to return to a parent. The parent wants more resources. It's overwhelming. And you can't do everything. Actually, you can do everything. You want to be qualified to do everything. But you really don't want to do that. You want to do the things that you're most qualified for with your education and expertise and delegating the other things. And it really works well in a practice. You know, the fact is, if you change nothing, nothing's going to change. You know the definition of insanity? Doing the same thing and expecting a different outcome. If you want your day to be focused on the things that you're most qualified for, if you want to focus on helping people and diagnosing problems, you want to spend your time doing that. You want to delegate the things to an assistant. It's a concept that's been endorsed for over 40 years. Review some of this information and embrace it because it will make your life better for yourself and for your patients. I hope you have enjoyed this conference. I look forward to hearing from you. And you can reach me at any of these addresses. Thank you so much for listening, and thank you to ASHA for having me.